पयलीं अशें आशिल्लें की भुरग्यांक स्मार्टफोन आनी जर लॅपटॉप दीत जाल्यार पेरंट्स म्हणटाले की भुरगीं पिड्ड्यार जातात. पूण मदींच कोवीड काळ आयलो आनी कोविडान सगळे जे गजाली आसा इवन शिक्षण डिजिटल मळार गेले. जे पेरंट्स आसा तांकां भुरग्यांक स्मार्टफोन हातीन दिवचे पडले शिकपा खातीर. खुबशे भुरग्यांनी ह्या गजालीचो बरो उपयोग केलो. तितूंतलींच 2 भुरगीं म्हणल्यार मिरामार शारदा मंदिर हायस्कुलाची तांकां दिसलें की तांणी एक असो ॲप तयार करचो की एक असो प्लॅटफॉर्म तयार करचो जे करून जे लोक आसात तांकां जर कितें मेडिकल एमर्जन्सी आसा जावं तांकां आपल्या हेल्था विशींची कितें म्हायती मेळपाक जाय जाल्यार ह्यो सगळ्यो गजाली एका मळार हाडपाचें काम ह्या भुरग्यांनी आपल्या ॲपाच्यान केलें आनी ते ॲपाचें नांव जावन आसा एकत्र ॲप. ही ल्हान माणकुली भुरगीं आनी तेंच्यांनी येदो व्हडलो विचार केलो. खुबशे जण म्हणटा की स्मार्टफोन जर भुरग्यांक दीत तेजो वायट परिणाम जाता, पूण ह्या भुरग्यांनी त्या गजालीची त्या संदीची फायदो घेतलो आनी तेंच्यांनी एक असो ॲप तयार केलो जो डे टू डे लायफान सगळ्या लोकांक खूब फायदेशीर पडटलो.
So first of all, our parents are doctors, so we wanted to do something that would help them. So we conducted a survey on SurveyMonkey and we got results like they needed better health infrastructure in rural areas, use of technology was needed in healthcare, and answers like that. Other statements which we got were the quality of health should be improved in Goa since it is a small state.
The national level healthcare initiatives, the Ayushman Bharat Digital Mission, the National Health Policy of India, and the National Health Mission, and they all use technology. Government hospitals in Goa. You can see that black pin over there, that is GMC, and the other red pins are the other hospitals.
GMC has all the good facilities and the specialists, but the rest of them they don't, and some of them are very far from GMC. That's why it becomes difficult for them to go to GMC.
Hence we created Ekatraa.
So Ekatraa is a phased project that will develop the healthy Goa with our current resources, and it's a single platform with all the healthcare needs. Also, this is the first time in India where all the healthcare facilities will be working on one platform. It will have real-time monitoring and automation of administrative tasks, and together it will lead to enhanced patient experience. The components of Ekatraa are the Ekatraa app and the Ekatraa website. They are both the same, but we have created an app and a website separately for the patient's convenience. We also have the use of AR and VR for the training for healthcare workers and patients. So doctors can train themselves how to do surgeries, and the patients can train themselves on their chronic diseases. We also have a virtual health assistant. So he will tell you where to go. So he can be like the doctor's personal assistant and help him with his duties to make it easier for him. In our project, we have used different technology like Arduino, HTML, CSS, IoT, Flutter, virtual reality, Python. And we have used systems like remote patient monitoring system, health data tracking and analytics, and health data security. Like I said, other than the virtual reality to help patients learn their diseases, we also have the virtual diabetes coach who will tell you how to take your insulin, and he'll provide support for the patients. He'll make sure they take a healthy diet and a lifestyle. So this here is our app. We have coded for it using HTML, as you can see here. So in our app we have many features. It is the same as the website, we'll be showing you later. So you can choose which doctor you want to meet and you can put your mobile number and the name of the patient. Plus you can get an appointment of when you want to meet the doctor and then send the request. Another thing is contact us. If you're finding any difficulty, you can just put your name, email and send a message to us through this. Next we have our real-time monitoring. We've used Arduino to code it over here, and so when you keep your finger like this on the pulse oximeter, it will send a signal and you'll be able to see your pulse as a graph. Yep, you'll get these kind of readings on that, and if your pulse anytime goes low, then it will send a beeping alert through this buzzer. This is our virtual reality with VR and AR. As you can see here, we have shown the heart, and you can learn through this. We have mentioned the parts and everything. This is good, but people use VR and AR for gaming, but over here we are using it for educational purpose.
Right on your left.
So basically over here it will show you which doctor you want to meet. So you can give the name, it will tell you left or right, because we've given it only 2 names right now, and then it will turn around and show you, this light will show you like that.
They wanted to do a project and participate in the robotics field. They did it here in Goa, and they were very successful. They built upon it further and went to the nationals and won the Judges' Choice Awards. This is a healthcare project which has got real world applications. It can actually be used in the real world. They have to develop it further, but I see a real scope for this going ahead, and it will definitely help patients and doctors alike.
It started off during COVID, and both of them, Ronav and Arian, are really interested. I think they take it off from their father and their grandfather. Both of them have been very interested in science, and he's always showed, instead of they do watch TV and they do play with phones, but not they use it like for robotics. On TV, he's always made sure that they watch programs like National Geographic, which has really helped them develop an interest in science and technology. And nowadays we know with and mostly because in the last couple of years, with the advent of pandemic where we couldn't actually go out, technology has really taken over. So it would be good to embrace this, and it's good for smaller kids to do it at an earlier age. We are learning now at this age. For them it's easier. So even the little one, she's just 6, and she's definitely learning how to code from her brother and how to use it. So I would say definitely we should go ahead, make sure we monitor how they're using it, and they can definitely take it from there. So they started off with the Goa regionals for the WSRO. They won 2nd prize for it, and the school has been very supporting and helping them out as well. And from there they took it to the nationals, which was in Ahmedabad, where there were a lot of participants which came from all over the country, and they got a lot to learn. The platform was huge, and it was really a learning experience for them. And at the nationals they won the Judges' Choice Award. So we are happy that they are taking interest in that, and definitely we are there to support, and we've got a lot of support from the school as well. Thanks.